Here in JMC, education has never been this flexible. It's been a year since the pandemic started, and we are proud to say that JMC breaks the limits of the pandemic climate and soars above its dark clouds. Indeed, no virus can stop us in delivering an assured, consistent, and quality education. This school year, to ensure that all learners will get the best learning experience, Jose Maria College Integrated Basic Education has intensified its two learning delivery options. We do believe that here in JMC, no child should be left behind.
Here are the two delivery options of Jose Maria College Integrated Basic Education. Option 1, online delivery. Students who have a stable connection to the internet shall undergo full online classes with our competent teachers on a daily basis. Online video conferencing between students and professors will be limited to 2 hours per subject each week. These online sessions will mostly be utilized for learning processing and delivering supplementary training. This is done to reduce the amount of screen time students spend while completing academics at home. Moreover, students shall also have self-regulated learning time or SLT to work independently on their learning modules. Teachers shall act as online learning coaches, guiding students' learning process. Option 2, self-paced learning. For students who see it as a challenge to secure a stable connection to the internet, teachers shall be providing modules and other instructional course packages where students can easily download on their LMS or learning management system. Students will work on these learning materials and from time to time may need to send their academic work online or discuss their progress with their teachers via email, chat, or video call on a scheduled time. They may attend online classes when their internet connection is stable enough for them to do so. Homeschool Partnership Program. Parents play a vital role in the success of online education. For students in preschool to grade 3, supervision of parents or guardians will be needed. Students should be more engaged in learning experiences. Parents and guardians shall never be a substitute for class and test hours. For students in grades 4 to 12, teachers shall consistently monitor the learner's progress and shall provide assistance at all times during the school day. Education goes on for the Jose Maria College. Your future is our mission. Enroll now!
Indeed, Jose Maria College has never been this flexible. So what are you waiting for? Enroll now!
Are you looking for the best online education at the most affordable school fees? Enroll now at Jose Maria College. Jose Maria College, under the leadership of its founding president, Pastor Apollo C. Kibuloy, holds true to its mission of providing an assured, consistent, and quality education amidst the ongoing crisis on COVID-19. To ensure that all students will get the best learning experience, JMC provides an assured education with the most flexible learning delivery choices. To highlight the learner's wit and abilities, JMC is consistent in providing the best learning exposures with a student-centered showcase of extracurricular activities. Amidst the challenges of the new normal, JMC guarantees that quality education is not compromised through our learner-centered curriculum, highly trained and dynamic faculties, and state-of-the-art facilities designed to deliver the best learning experience to our students. We are proud to say that JMC is fully equipped for new normal education. What are you waiting for? Enroll now! Scan the QR code on your screen for more details. Your future is our mission. Enroll now!
Good day, everyone. Welcome to another episode of JMC EduTrends, a discussion that informs, inspires, and transcends. To all our first-time viewers, this program streams live on www.facebook.com/Jose College and on YouTube at JMC EduTrends. Don't forget to type in your comments and questions, send your emojis, click the subscribe button, and ring the notification bell so you would be notified of future discussions on JMC EduTrends. Without much delay, ladies and gentlemen, help me welcome the program host of today's discussion.
Ladies and gentlemen, folks and friends, on behalf of Jose College community, I welcome you all to another episode of JMC EduTrends, a discussion that informs, inspires, and transcends. This is your host, Lord Vincent Juan Mendoza, the head of digital marketing of this great academy. And I'll be with you in this another special episode of the show. This is being broadcast via official YouTube and Facebook channels of Jose College. And in this episode, so entitled SPMC Journal Healthcare Services, an Intervention Against COVID-19, the SPMC Experience, this gives you a walk around to Davao City's medical frontliners' effort to contribute to local and international efforts to broaden the knowledge base of healthcare services as an effort to flatten the curve in the statistics of COVID-19 patients. That being said, we have invited a very esteemed medical practitioner for us to learn how the community can benefit from all the contributions shared by our medical health practitioners and healthcare frontliners. But meanwhile, let us first do a quick shout out to some of our friends joining us now live on Facebook and YouTube. We first have joining us in the show. Ayan po, shout out po to Briza, Luis Vallejo Vellantes. We have Barahasa, Milka, BSBA3. Another one, we have Stephen J. Galarpe. And Hajime Mashe. I don't know how to read it. Also joining us is Jacqueline Garcia. And we also have Erika Magdugo. There you have it, ladies and gentlemen. And of course, joining us in the show later on are our student reactors and our Dean of College of Medicine, who will share with us their insights on this very timely discussion. All right, without further ado, ladies and gentlemen, may I first call on my colleague, faculty of JMC College of Medicine, to introduce our guest speaker this afternoon. Ladies and gentlemen, would you please help me in welcoming Ma'am Chat Kasha. Ayan po. Good afternoon and welcome to the show, Ma'am Chat.
Good afternoon, everyone. Maayong gabi sa tanan. Happy Kadayawan for Davao City. So for this afternoon, I am so honored to introduce one of my mentors in the family medicine specialty. Our distinguished speaker for this afternoon is, of course, a certified Davaoenyo, and he is a public servant for almost 3 decades. So kayo na ang magbilang. but not yet a senior citizen, of course, sir. He is also a fellow in Philippine Academy of Family Physicians, or known as Family Medicine, and currently the regional director of FPAFP East Mindanao chapter. Our speaker for this afternoon got several awards, and there are too many to mention, but I have to mention some. In 2016, he got an Alumni Achiever Award for Health Facility Management from SPC, or San Pedro College. In 2018, he had been also awarded as the most outstanding Filipino physician by Dr. Evelyn Tantoco Gusi Awards. And in 2020, recent, he's the most outstanding physician granted by the Philippine Medical Association. He is also into academe, teaching nursing and PT, or physical therapy rehab medicine. Our speaker has been with the SPMC, or the Southern Philippines Medical Center, for 28 years. He is also the former Chief Training Officer and former Chief of Clinics as well. Presently, he is the chair of the COVID task force of the institution SPMC. For your information, he is not only a medical practitioner or into the administration of SPMC. Our speaker is also a triathlete and one of the Ironman of the Philippines. And personally, he is my Papa Piolo of SPMC Family Medicine. So everyone, let us virtually welcome and listen to the Medical Center Chief of SPMC, Dr. Ricardo Audan.
Yes, thank you, Dr. Cassia, no, for that kind of introduction. Mukhang nabigla ako yung Papa Piolo, murag layo lang kayo. I don't know where you got it, but anyway, it's an honor to recognize that kind of production. Yes, I've been your mentor, and it's always see also our students also doing well with uh, with their job, with their clinics, and of course with others. No, the slide. Of course. Okay. Cha, hello.
Yes po, Doc, we can hear you po.
Yes. Can you see my slide and can you hear me? Hello, Mr. Mendoza. Can you see my slide and hear me?
Yes po, Doc, we can hear you po.
And can you see my slide?
Um, Mark, can we present his slide? All right, I think it's loading, Doc. All right, there you have it.
Hello.
Okay na po, Doc.
Nakaka-
Full screen na lang
Okay
po.
na?
Yes po, Doc.
Okay, can I start now? Hello? Hello?
Yes po, Doc.
Hello?
Yes po, Doc, we can hear you po.
Mr. Mendoza, can you hear me?
Yes po, yes po.
Wala lagi ko.
Hello, Doc, can you hear me po?
Yes, yes.
All right.
Pero
All good, Doc.
makita bang slide? Ako naman ko.
All right. Doc, pa, ano na lang po ng ano po, slide show view po dun sa ating PowerPoint po, Doc. Alright, okay, all good.
Yan, okay na yan?
Yes po, Doc. All good.
Hello, okay na yan? Wala lagi, no?
Yes po, Doc.
Okay. So, I will start na, ha? Hello, Mr. Mendoza, I will start na.
Yes po, Doc. Yes po.
Okay.
We can hear po.
Okay, thank you so much. Good afternoon, everyone, to the staff of the JMC, the students, the faculties, to Dean Arce, and especially to our beloved Reverend Executive, Dr. Pastor Kibuloy, and to the Vice President for External Affairs, Dr. Mark, inviting me as your resource speaker on today's lecture entitled SPMC Journal Healthcare Services, an Intervention Against COVID-19, the SPMC Experience. It is indeed an opportunity for me as SPMC's Medical Center Chief that I'll be given a chance to speak live on this manner to share my insights on this COVID-19 pandemic, especially that it is the most pressing issue we are facing today. Let me give you a brief background in this COVID virus. Makita ba? December 2019, a novel coronavirus named Severe Acute Respiratory Syndrome, Coronavirus 2, or the SARS-CoV-2, caused an international outbreak of the respiratory illness COVID-19. Since the initial outbreak in China, SARS-CoV-2 has spread globally, and COVID-19 has now been labeled a public health emergency of international concern by the World Health Organization. The full spectrum of COVID-19 ranges from subclinical infection over mild, self-limiting respiratory tract illness to severe progressive pneumonia, multi-organ failure, and death. Currently, COVID-19 is spreading all over the world, and the Philippines is not spared from it. Fast forward, last August 13, 2020, Mayor Sara Inday issued an executive order number 47-A, Section 17, appointing SPMC as the primary hospital for suspects and confirmed COVID-19 patients. This itself inflicted a major change on the hospital's existing assiduous tasks. Since then, SPMC has long been maintaining COVID-19 daily statistics and graphs, which monitors positives and active patients, as well as the number of recoveries and deaths. This is now our data as of yesterday. As you can see on the left side, we got 36 positives last August 18, recovered 35, and that's about 6, no? And as you can see here, medyo mataas yung death namin, about 10.5. But if you compare it with the Philippine General Hospital, we are much lower than their mortality. But if you compare it with the national data, it's quite high. On the right side, we have the SPMC laboratory test. So we have the positivity rate of 16.28%. It's quite high, meaning to say these are patients tested positive for the first time. The ICU beds, we have 94.57%, meaning to say out of the 92 beds that we have, 87 of the beds have been utilized. And the ward isolation, we have 432. We have 359 out of 432. So meaning to say we have 83.10%. As you can see, we have a total of 92 ICU. But originally, we only have 15 to 20 ICUs. But because of the demand, we have to convert all the private rooms into ICU, collapse all the areas in the main hospital to convert it to COVID wards. As far as our psychiatric department or the IPBM, the Institute of Psychiatric Behavioral Medicine, which is about 3 kilometers away from us. Kaya we were able to reach 524 beds all in all, nearer already to 50%, since we are mandated to have 50% beds allotted for COVID. We have to close the OPD face-to-face and resort to telemedicine consultation. However, COVID cases are not the only one we are entertaining. There are actually more patients who are not COVID that we also have to facilitate, like trauma, pregnancy, delivery, stroke, and others. That is why we have to dedicate the orthopedic building for the non-COVID cases. So in this building, in this structure, we solely put all the non-COVID cases in these orthopedic buildings. This is our modular hospital. It has a 44 beds capacity, and it's already done and to be turned over next week. Our continuous challenge is really how to get staffing. Though slowly, we are now attracting nurses to work with us because we have increased our salary from 711 to 1,190 per hour for the job contractuals. Once we have the staffing, we will open this one. So all in all, we will reach to 568 COVID beds, still lack 32 to make it 600 beds. However, that's already 47% high. This is showing to you a graph, no? Let us go over with a declaration of the community quarantine. March 15 of last year up to May 15, that's almost 3 months, Davao City was into the ECQ. So as you can see here, wala po tayong pasyente because when we say ECQ, everyone is not allowed to go out. All public transport are suspended, and only sectors that provide essential goods service are allowed. For everyone is not allowed, only the frontliners are allowed to go out. Kaya it's something like no man's island. Yes, actually ang masaya dito are the frontliners because you see no transportation in the highways, no? So, however, ang drawback nito talagang the economy really went down for this matter. So that was March 15 to May 15, and only 1 or 2 patients were diagnosed to have a COVID dito. And so after the 3 months, Davao City declared GCQ. It's almost 2 months or 1 month to 2 weeks. And again, konti pa rin ang pasyente natin, no, for this. And when we say GCQ, again, everyone is not allowed to go out, again with exceptions. And this time, public transport are allowed to go out with social distancing observed. Okay. So this time, more businesses are allowed, such as malls, hardware, TV, and music productions. Okay. So nakita nyo from March 15 to June 30, okay lang ang patients natin. Konti lang talaga, 1 to 2. The maximum we got was 4 for this. So, kaya Davao City decided to lift GCQ and declare MGCQ from July 1 to 19 of November. That's 4 months. No? So when we say MGCQ, people may move between GCQ and MGCQ except for leisure. Public transport may operate with social distancing observed and more businesses allowed to resume operations. However, as you can see here, no, with the MGCQ, kasi medyo relax na tayo dito, nag-increase yung mga cases natin. Sometime in September and November, mataas masyado yung cases natin. That's why Davao City has to go back to GCQ for the whole month of December. Kaya in the whole month of December, it was really a silent night when we did not celebrate Christmas, no party, no liquor, because there was really a liquor ban on this. No reunion and other activities. In fact, it was in December that we were celebrating the first year anniversary of the COVID, the first time it was discovered. So nag-GCQ tayo after we have noticed that a spike of increase in September and November. So when 2021 came around in January, Davao City declared MGCQ kasi we observed that in the whole month of December, konti naman yung cases natin. However, when we had the New Year, this was already the post-Christmas. So Davao City again has to declare MGCQ from January 1 to 31. And then, tumaas dito sa January, no? Kasi post-Christmas siya, post-Christmas. That's why Davao City again has to revert to GCQ from February 1 to May. That's 3 months, no? From February 1 to May. So here, nakita mo, there is a decrease again of the cases. However, even up to May with the GCQ, nakita natin na medyo tumataas talaga yung kaso. Tumataas talaga ang kaso starting in the month of May. That's why instead of going to ECQ, kasi ang taas talaga dito, we resorted to MECQ. So MECQ is when people may move between GCQ and MGCQ except for leisure. Public transport may operate with social distancing observed. More businesses allowed to resume operations. No? So ngayon siya. And then, in July 16 to 31, it reverted back to GCQ with heightened restriction. So what is this? No? So until of this end of August, we are GCQ with heightened restriction. When we say heightened restriction, so this is based on the guidelines released by the IATF in May that indoor dining is allowed at 20% seating capacity or outdoor dining is permitted at 50% capacity. Tourist attractions in the area may also open at 30% capacity. So we still don't know after August 31 kung ano ang community quarantine level natin by September. But based on this data, medyo nag-decrease na naman tayo of cases. So it was also in the month of June that Delta virus was detected. Remember, there were 2 positive Delta virus in the Davao province, one from Tagum and one from Talomo, Davao City. And what was good here is that the patients were all recovered because ang mahirap lang kasi dito, the result, we submit suspicious samples in the Philippine Genome Center and the results will take quite some time, about a month for the result. By the time we got the result after a month, recovered na ang patients. Okay. So ito yung just spoke, no, na comparison between ECQ, the MECQ, the GCQ, and the MGCQ. Now, just showing to you, no, that we are 5,600 employees, and since March of last year, as of August 16, we have already 980 personnel who got infected with the COVID. And of course, luckily, discharge is 909. And at present, we have 66 employees admitted. Unfortunately, we have 5 expert employees. These 5 expert employees, only 2 are on the tour of duty. The rest of the 3 were actually out of duty. So sa 5 naman, we have 1 nurse. Yung nurse naman namin, bale, sick leave siya for a year because of cancer. The other one is a nursing attendant. The 3 are admin personnel. So yung 66 on the right side, these are some of the TTNF, no, that SPMC is affiliated, meaning ng TTNF, Temporary Treatment Monitoring Facility, where we also admit patient there. Now, in SPMC, we only admit moderate, severe, and critical. Pag mild ka, we usually endorse you to the different TTNF affiliated by SPMC, just like in this right side, no? Okay. Now, these are the professions, no? So, ang marami ang nurses sa amin who got infected with the virus, followed by the doctors. Then you have the other staff, the nursing attendants, and down the line. So, these are also the residents, no? We have to know kung saan residents sila. And topping the list for the residents, we have the Buhangin, then Poblacion, Talomo, then we have Bahada, and down the line. So we monitored SPMC personnel, no? So as of today, as of August 16, we monitored 212 SPMC personnel. Out of these 212, 48% coming from the non-COVID area, and 52% or 110 coming from the COVID area. So, ito yung mga professions nila, no? So, again, topping the list, we have the nurses, followed by the nursing attendants, the doctors, the admin, and down the line. So, yung areas of assignment namin, surprising to note that there was an increase in the operating room, no? Dapat kasi red zone sila dyan, so dapat full PPE talaga sila. But it was really surprising to us that 34 of them got infected of the virus. So, as you can see here, we have the ER, only 12, and the rest of the areas of assignment. So, we stratify the risk, no? For the 212, unconfirmed is 120, suspect is 38, and healthcare workers, high risk, we have 54. Take note in this, no? So living in the same household. Kaya very important, we really encourage our employees that hindi lang ikaw magpabakuna, dapat lahat kayo inside the house, 18 and above, dapat magpabakuna because of the increase of data on this. And the other one is eating together with co-workers. Dati-rati, kaunti lang ito, no? But siguro because of kumpiyansa, tumaas na naman ang ang data naming 18 to 30. In fact, we really impose this hospital memorandum, subject sanctions for violation of mandatory use of face mask, face shield, and others. No, when you have first offense, we have reprimand. Second offense, 1 week suspension without pay. Third offense, 2 week suspension without pay. And fourth offense, recommendation for dismissal. So, what is good here, wala pa tayong naka fourth offense, no? Kasi hanggang first offense lang sila, because sa first offense pa lang talagang bigyan na namin ng mga sangkatutak na mga what is this, notice, and they had to, there is a guidelines that they should join reorientation of the importance of COVID, importance of health precautionary measures. So, you might ask, ito ba mga empleyado nabakunahan na ba? Of course, yes, no? So as you can see here, ito yung sa left side are the different vaccines. Ito yung mga employees natin. So as you can see here, even naka-second dose na sila, fully vaccinated. Astra, we have 17. Sinovac, we have 89. Pfizer, we have 5. Gamaleya, we have 1. Janssen, we have 1. So nakikita nyo dito na probably we can say that it's not a guarantee if you are vaccinated, you will get full protection from the vaccine. So no. So what is good here also is that lahat sila mild, asymptomatic or mild symptomatic, basta hindi sila moderate, hindi sila severe, hindi sila critical. Okay? So ito yung mga different vaccines, no? As you can see here. So for the efficacy, kung makikita nyo, hindi naman 100% ang protection except for the Sputnik, no? 100% against severe COVID-19. Just in case magka-COVID ka, you'll never get a severe COVID case of here. And goes through with the other vaccine. So lahat ito naman sila ang nabigay dito sa amin sa hospital. And very important that all these vaccines were given or granted emergency use authorization, or the EUA. What is this EUA? Medical content, including vaccines, during public health emergencies such as the current COVID-19 pandemic. Under the EUA, FDA may allow the use of unapproved medical products or unapproved uses of approved medical products in an emergency to diagnose, treat, or prevent serious or life-threatening disease just like COVID. So, or condition when certain statutory criteria have been met, including that there are no adequate, approved, and available alternatives. So once submitted, FDA will evaluate an EUA request and determine whether the relevant statutory criteria are met, taking into account the totality of the scientific evidence about the vaccine that is available to FDA. So lahat ng bakuna na naibigay dito, whether donation or purchased by the government, are all given or granted emergency use authorization. Are the vaccines rigorously tested? Yes. There are 3 phases of clinical trials. We have the phase 1. So this focus on safety and include 20 to 100 healthy volunteers. In phase 1, scientists begin to learn how the size of the dose may be related to the side effects. If possible, at this early stage, scientists also try to learn how effective the vaccine may be. If no serious side effects are found in phase 1, next is phase 2, which involves several hundred volunteers. This phase includes studies that may provide additional information on common short-term side effects and how the size of the dose relates to immune response. In phase 3 studies, hundreds or thousands of volunteers participate. Vaccinated people are compared with people who have received a placebo or another vaccine, so researchers can learn more about the test vaccine safety and effectiveness and identify common side effects. Clinical trials are conducted according to plans that FDA reviews to ensure that the highest scientific and ethical standards. The result of clinical trials are a part of FDA's evaluation to assess the safety and effectiveness of its vaccine. The trials and other data must show that vaccines benefits outweigh the potential risks or side effects for people who will be recommended to receive the vaccine. Only if a vaccine's benefits are found to outweigh its potential risks does FDA grant a license for the vaccine, allowing it to be used by the public. And so, which vaccine is best? The Department of Health urged that the local government units not to use vaccine brands in promoting the vaccination. DOH reiterated that all COVID-19 vaccines issued with EUA by the FDA are safe and effective. And before a vaccine can be issued with an EUA, it has to undergo rigorous evaluation processes involving the Department of Science and Technology, FDA, and various vaccine expert groups. So again, which COVID vaccine is best? Again, the DOH maintains that the best vaccine is the one that is available now, regardless of the brand. Let me show to you the SPMC vaccination status. No? So this was data from our XR. I told them we have actually 5,686 employees, and we are still collating ilan talagang nabakunahan namin. No? So I told the XR to make a data of this. And as of August 16, the XR got 3,475 responded, and that's about 61.12%. So at least konti na lang, no? Probably next week makuha namin ang full picture of the SPMC, sino talaga yung na bakunahan. But out of these 3,475, 5% are unvaccinated, 2% is still at first dose, and 93% is fully vaccinated. So at least malaki siya. Well, we cannot really get 100% SPMC vaccination for that matter, for the reason of this, no? Sabi dito, no vaccine, no work policy is not allowed. Based on DOLE Advisory Number 3, Series of 2021, all employees may encourage their employees to get vaccinated. However, any employees who chooses not to get vaccinated or fails to get vaccinated shall not be discriminated against in terms of employment. Additionally, Republic Act 11525 states that vaccine cards shall not be considered as an additional requirement for employment purposes. So ito yung medyo ang nagbablock sa amin na we cannot get 100% vaccination. However, during our task force meeting last Tuesday, yesterday, we will propose to the Department of Health, even to the city government, to Mayor Inday Sara, that if you are in the hospital it should be a mandatory that all employees should be vaccinated. But as of this time, it's not mandatory. I think it's also interesting to know ano yung mga prevailing reasons for the unvaccinated employees. Ito yung mga prevailing reasons for the unvaccinated. We have pregnant, religious belief, scared of side effects, medical deferral reasons, undecided, postpartum, and down the line. Now, pregnant ngayon, nag-release ng ang association or society ng OB that at any gestation you can have the vaccination. You can have the COVID vaccination. So wala na siyang hadlang. It's not already a reason that you'll not be vaccinated. Religious belief, I really do not know. I have to really dig ano itong religious belief, no? Kung kasi baka scapegoat lang din ito nila. So, these are, as you can see, itong mga reasons nila, we can actually convince them to be vaccinated. That's why the HR and the personal health section of SPMC join forces in orienting these unvaccinated personnel. I hope that by next week, this 173 will lessen. No? So. In the whole of Mindanao got vaccinated by no other than Secretary Francisco Duque. No, as you can see here on the right side, looking on, we have Secretary Nograles, we have Secretary Galvez, we have General Seno ba yan? General Seno. Then we have Secretary Ruque, and you have Secretary Bello. Ang hindi nakita dito si Secretary Panelo, yung the former spokesperson of the Malacanang. So it says here, vaccination brings hope. It brings hope, but they alone will not end the pandemic. We must not let down our guard even as the number of people vaccinated increases. Ang importante, we will develop herd immunity so we can go back to our normal activities. Okay? So ano ba itong herd immunity? At least ma-attain natin ang 75% of the total population. That's why in SPMC, I really like na kung pwede lahat kami dito mabakunahan kasi kami-kami na rin dito eh. So, sino bang dapat i-prioritize when it comes to vaccination? So I think this is just a review for you because you know this. So you have the A1, you have the frontline workers in health facilities, whether private or government. Okay. Then A2, senior citizens age 60 years old and above. A3, person with comorbidities not otherwise included in the preceding categories. We have the A4, frontline personnel in essential sectors. No. So this includes the uniformed personnel and those working identified by the IATF. Then A5, we have the indigent population. Then you have B1, teachers, social workers, B2, other government workers, and B3, other essential workers. So far, we are in A1 to A4 pa ngayon. No? Sometimes A1 to A3 or yan. Hindi pa tayo nakaabot ng A5 because of the limitation of the vaccine. So, COVID-19 vaccines are effective. They can keep you from getting and spreading the virus that causes COVID-19. COVID-19 vaccines also help keep you from getting seriously ill even if you do get COVID-19. Getting vaccinated yourself may also protect people around you. Vaccines continue to be highly effective at preventing hospitalization and death, including against the variants. So when we talk about variants, let's briefly talk about the Delta kasi ito yung medyo medyo hot ngayon of the variant. There are many variants. You have the alpha variants, you have the beta variants, you have and this Delta variants is quite very transmissible. Ganito yan siya, no? So, in the left side, this is the original strain, or if you have the alpha and beta can only transmit in this diagram and only about 15 minutes, no? Pero when we say Delta variants, it can transmit in a second. In a second siya. That's why ang bilis mag-transmit. That's why itong very important, no? Itong Delta variant. And fortunate enough, yung mga Delta variants natin sa Davao, we have already 13 variants identified in the Davao province. Fortunate enough, they were all recovered. And I think the contact tracing were also quite promising. Parang okay lang din, no, for this. Okay, so noon sinasabi mag-contact tracing pag alpha, beta ka, kasali ka sa contact tracing if you're exposed within 15 minutes. But if you talk about Delta variants, it's not minutes, it's seconds. So, from John Hopkins, sinasabi dito, do we need COVID-19 boosters? Sabi nila, if you're fully vaccinated and you're living in a place where case number is quite low, there's no need. But if you live in a place where the cases are rising, then it did not say there's a booster. But it says here, you have to continue wearing a mask, face shield, do social distancing, and avoid crowded public places. So, do I need to have a booster right now? It's not, because it says here that all the vaccines, no, especially authorized in the US, have an excellent job of protecting people against getting severely ill, hospitalized, or dying from COVID. Will we ever need boosters for COVID? Maybe. Sabi dito is maybe. Unless the variants that emerge are resistant to the formulas, no, are resistant to the vaccines. But so far, the study shows that the vaccines are can protect the variants. And ang third booster or ang booster naman is still under study for this. So, if you are fully vaccinated, are you invisible? Of course, no. No, you can still get the virus, as what I have shown to you the data, because the vaccines will not give you 100% protection. However, if you acquire the virus and fully vaccinated, surely you only get a mild case COVID. So what about treatment for COVID-19? Meron ba tayong treatment? There is currently no proven treatment for COVID-19. To control the growing COVID-19 pandemic, we rely on quarantine, isolation, and infection control measures to prevent disease spread, and on supportive care, including oxygen and mechanical ventilators. However, today, different drugs exist that are currently being assessed for patients with COVID-19, which are approved by the WHO as compassionate drugs. So ito yung mga gamot, no, na approved by WHO. We have the remdesivir. So remdesivir is used to treat Ebola virus disease. You have the tocilizumab. It's used to treat rheumatoid arthritis. Then you have the favipiravir, you have the dexamethasones, and the enoxaparin that is anti-blood clotting. Okay, so these are the medications that we give to our patients. It depends on the gravity of the illness. You know how much will cost for these drugs? Remdesivir will cost 1,685 times 6, that's 10,110. That is based on the government uh, rate. Of course, when you are confined in private hospitals, of course, mataas ito. Tocilizumab for 80 milligram, it's 5,524 times 5. That's 27,620. If you use tocilizumab 400 milligram, that's 30 to 35,000, no? 30 to 35,000. So medyo mahal yung gamot. Okay. What could be the best option? What will be the option? There's a lot of misinformation around, circulating around, and you might have heard of ivermectin. Remember, FDA has not approved ivermectin for use in treating or preventing COVID-19 in humans. Ivermectin tablets are approved at a very specific doses for some parasitic worms, and they are topical on the skin formulation for head lice and skin condition like rosacea. Ivermectin is not also an antiviral. That's why the DOH and the FDA issued a public health warning not to use this drug. However, in Metro Manila, I think there are two hospitals who are using this, but they use it as an investigational drugs. When we say investigational drugs, drugs that are being tested but have not yet been proven or approved by the U.S. Food and Drug Administration. So, what else do we give when you are a patient of COVID? Of course, we also have the oxygen, the mechanical ventilators. Oxygen is actually a medicine, no? So, for this data as of today, we have a very sufficient mechanical ventilators. Now, remember, we only do not cater COVID, but we also cater non-COVID. That's why, as you can see here, mas mataas pa yung non-COVID mechanical ventilators that is needed as compared to the COVID. No? So, ito yung mechanical ventilators. So, for the high-flow oxygen nasal cannula, yan po ang high-flow oxygen nasal cannula. It's, ang dati kasi, after the mechanical ventilators or after this, before this nasal cannula has been introduced, we go directly for intubation. Ngayon, intubation is the last resort to do the procedure. So meron tayong high flow oxygen nasal cannula. So again, we also have this in the non-COVID. So far, we have a sufficient high flow and mechanical ventilators. Ang high flow oxygen, ito yung unit na ang lakas kumain ng aming oxygen. And just to give you information, we have oxygen plants, 2 oxygen plants, 6 generators, and can produce 873 tons per day. However, the oxygen consumption we needed every day is 1,250. That's why we have to tie up with the Linde and the price gas. No? But if worse come to worse, just like we are anticipating of this surge of this variant, we have an upcoming hyperbaric oxygen plant that will be finished at the end of this month and can produce 300 tanks per day. So if you ask me, sufficient pa ang SPMC when it comes to oxygen. So, saying this, no, with the medication, the oxygen, magkano kaya ang magasto natin? Magkano kaya magasto ng patient? O how much ba ang claim niya sa PhilHealth? Just to give you a background. So, ito yung benefit ma-avail ng isang pasyente. If you are mild pneumonia, you'll get from PhilHealth 42,997. If you have moderate pneumonia, you'll get 142,267. And if you have severe pneumonia, you have 333,519. Pag critical pneumonia ka, 786,384. So ito yung mga availment by the package ng PhilHealth. No? So of course, mahal din ang gamot. And of course, ang oxygen may bayad din siya. So just to give you a background on this, a little background on this. So other than this, we also offer mental health and psychosocial support during COVID-19. This is to remind everyone that it is normal to feel sad, stressed, confused, scared, or angry during those difficult times, especially if you are being advised to isolate, to quarantine. No? So, I don't know if one of you here have already experienced, no, na isolate ka, na quarantine ka. So, meron siyang kaba, meron siyang anxiety. So, psychosocial support can include counseling, education, spiritual support, group support, and other services. These services may be provided by psychiatrists, psychologists, social workers, psychiatric clinical nurse specialists, counselors, or pastoral counselors. Because if you are in the hospital also, you may also develop pandemic fatigue. No? This can occur when people get tired of the pandemic measures and become less likely to follow public health practices. That's why ang mga duties ng mga nurses namin dito, instead of 22 days, we give them 16 days, those assigned to COVID should be their quarantine or their rest day, no? Para hindi sila magka-fatigue for this matter. So, what can I do to prevent the spread of COVID-19? So, at least you have 1 meter or 2 meters. Wear a face mask. Or ngayon, face mask plus face shield. Avoid places that are crowded. Wash your hands regularly. Or use an alcohol-based hand sanitizer. Of course, kung hindi ka pa nabakunahan, magpabakuna ka na. Keep rooms well ventilated when you are inside with other people. Do a cough, have a cough etiquette, no? And stay at home and call your health worker if you are unwell. So, this slide will show to us more or less ang estimated risk reduction if you do this, no? So this is from Dan Herrera et al. 2020. Excuse me. Kung naka-mask ka and the face shield, you have 93% reduction. Kung naka 1 meter distance ka with mask, you will have 94% reduction. Pag 2 meters ka plus mask, it's quite high, 97% reduction. Pero, pag ginawa mo 1 meter distance, naka-mask ka, naka-face shield ka, it's 99% reduction. So, with this kind of health precautionary measure, we can actually prevent the virus invading us for this matter by just doing this, no? Even by just doing mask and face shield, 93% na siya, no? Or mask and 1 meter distance. So it's very simple, very doable. And I think this is my last slide. According to Dr. Oma Vaidyanathan, an OB gynecologist, she said, no nation in the world will be able to control COVID by increasing beds, oxygen, ventilators, and ICU wards. This is a temporary, impossible, and very expensive solution. If healthcare infrastructure was the answer, then developed Western countries wouldn't have had that many cases and that many fatalities. So, hindi ito sa first world, hindi ito sa third world, hindi ito sa second world, no? Kasi nga, ang sinasabi dito, kung ang basihan is talagang paramihan ng mga oxygen, ventilator, structure, siyempre, number 1 ng US, number 1 ng Europe. How come sila ang number 1 ngayon sa COVID cases? The long-lasting, inexpensive, and quickest solution is social distancing, wearing masks, and those that I have mentioned to you. So, ito daw, no? Those I just mentioned to you. And remember, hospitals are not built to stop road accidents. This can only be stopped by careful driving. And very importantly, it's the behavior of the people which decides the course of the pandemic. Kahit bakunada ka na, if you yourself is not still practicing health precautionary measures, talagang magkaka-COVID ka talaga, no? So, in this, again, thank you so much for listening and good evening.
There we have it, JMC EduTrends family, the Chief of Southern Philippines Medical Center, Dr. Ricardo Audan. Let me just do a quick shout out muna to our viewers joining us on Facebook and on our other social media channels. Bilisan lang po, we have Jericho Galot, ayan, joining us in the show. We have Gabriel, Crystal, shout out po sa inyo. We have Cresa, Jasreal, Zebedi, Cresa, Hannah. We have Jave Mendoza. And yes, joining us also is Dr. Libre. We have Yazul Carnin, Dwayne, Florabel, Gwen, and ayan, Micaela. There you have it. And ladies and gentlemen, we will be right back after a short break. And when we come back, we'll have our reactors on board. And we shall also entertain your questions posted on our social media channels. Please do stand by with us and let us all together watch this.
The world is falling apart. Every day is breaking our heart. What happened to the world? If we're all lost, what happened to the place we call home? Let's fight the sun's enemy. Let's be one, you and me with unity. No matter what pain, no matter what strife, we can make it through with God on our side. Some sort of battle we unity. No matter what pain, no matter what strife, we can make it through with God on our side. Look what things can get better. To break beliefs we can conquer. Distance and difference don't hinder. Fear not, we're all in this together. Look what things can get better. To break beliefs we can conquer. Fear not, we're all in this together.
And we are back. As promised, we shall hear the reactions of some of our JMC friends who are into medicine. To facilitate the panel reaction and the open forum, may I call on Dr. Raymond to identify our panel members. Dr. Raymond, good evening and welcome to the show po.
Hello, good afternoon. Good evening. Magandang gabi na po sa lahat. Good evening po, Doc Audan. Thank you for that very insightful and comprehensive discussion on the current situation, the current COVID situation here in Davao City, especially in Southern Philippines Medical Center. Kasi marami talaga nag-wonder, ano ba ang status? Is it maraming tanong, puno na ba ang SPMC? Ano bang ginagawa nila? Ano mga medications are available? No, even the issue on oxygen supply has been addressed kung saan tayo kumukuha. So, we are very thankful. Kasama natin actually, nanonood ng live stream na to ang mga medical students from the JMC College of Medicine. So some of them are here as representatives from the different year levels. For the third year, we have student reactors from the third year level, si Miss Kimberly Zamora and Miss Jan Lizal Dandan. No? Also, from the second year level is Miss Maria Concepcion Cortez, Mr. Amir Imusan, and Mr. Joshua Agawin. Aside from that, nandito po our primary actor from the faculty, no other than the Dean of the College of Medicine, Dr. Nestor Arce Jr. So, I think I hope this will be this is an open forum, or some of the questions from our medical students and our faculty and staff will be coursed through sa ating mga student reactors and through me, and hopefully we can provide some insight, no, as a group. So I would like to give the virtual floor to our Dean, Dr. Nestor Arce, to give us reaction or insights on the COVID-19 situation and the discussion by the Chief of Hospital, Dr. Ricardo Audan. Doc Nestor.
Thank you very much, Doc Raymond, and magandang gabi po sa lahat na nakikinig ngayon sa aming live streaming. And we would like to thank Dr. Audan for the time and a very insightful information with regards to the condition of COVID-19, especially in SPMC. And we all know very well that SPMC is one of the leading referral centers that we have, because for the information of everybody, aside as a Dean of College of Medicine, I'm also one of the Department of Health COVID physician who was hired under the Bayanihan Act of 2021. So actually, I'm working in two areas in the Davao area, particularly in Digos, and at the same time, one area in Kidapawan City. So I am very grateful for the time, okay, Dr. Audan, and also this is also the appropriate time for me to thank the men and women of SPMC. Some of them were my students, and for the information of everybody, I am also one of the statistics of COVID-19 pandemic. Okay. In fact, if I remember it right, adun yata ako sa pinaka-peak ng information na binigay ni Dr. Audan kanina, because I spent my new year in SPMC and I thought I cannot anymore go out as a result of the COVID-19 infection. And this is always the risk that we have as COVID doctors. And you have heard that marami na rin mga doktor ang nagkaroon ng COVID infection, and I, for one, would be one of them, and I'm the survivor. Siguro, may purpose pa rin Okay, and I think the information that we have gathered this evening is a very insightful information, because in reality, if you would try to look on, there's still no known treatment as of this moment. Okay, and if you would try to look on, we are still currently in the midst of a worldwide trial that has changed our lives beyond recognition. Okay, it is a challenge on the global level since the coronavirus do not respect regional boundaries. But at the end of the day, if you would try to think of, most of the panangga natin talaga are basically more on the preventive measures. And I think these are the things that I would just to reiterate for everybody, because I think prevention is better than a pound of cure. And we all know very well, okay, with the research that we are basically ongoing right now, wala pang effective treatment with regards on fighting coronavirus as an infection. So it's your immune system talaga ang major factor to consider. So I just like to reiterate to the public that masks are basically very important, useful tool. Okay? With the use also of minimum health standard, this is very, very important wherever you go. Wala tayong magawa because we humans are basically very resilient. And I think this is already the new trend that we will be having right now, the utilization of masks. And of course, I also would like to reiterate information. The vaccines are very important tools in terms of preventing us having severe COVID infection. This is very important. Vaccine do not prevent us having COVID virus, but rather it basically protect us from preventing having severe COVID virus infection. Okay, kaya minsan nakakarinig ka sa mga madlang people natin sa public that they would say, na-vaccinate ako, how come I got COVID virus infection? Well, at least it would protect you from severe infection. Mild lang ang mga symptoms na manifestation natin. But then again, on the question on how long are we going to have this protection, the question is still being in search. And we're having research right now in conjunction with Thailand, okay, with regards to the antibody levels of patients who have infection. And I do hope this year we'll be able to answer those questions. But like the uncertainties of answering those questions remain to be a dilemma, especially in the medical world. But we in the medical frontline are doing our best to search for the answer in an effort to control this infection to this one. Okay, and as a segue also this one, we need to take our mental health seriously, because I think one of the most effective way of preventing the spread is isolation and quarantine. Okay, siguro kami mga medical frontliner will become parabang Bachelor of Science in isolation and quarantine. We become experts because every time we go in and every time we go out, habang wala pa yung mga result ng RT-PCR, we are basically in isolation because we are basically COVID-19 suspect. And I, for one, I do travel a lot. And when you go out of the country and enter certain countries, you go on quarantine. When you go back to the Philippines, you go on isolation. And the toll of being isolated alone in a room, okay, would have a profound effect in terms of what the mental well-being of your patient. Okay, so somewhere along the way, we have to consider this one. Pero sabi nga natin, at the end of the day, it's still human resiliency as the most important aspect that we have to consider. Sabi nga natin, sama-sama tayo sa pagsugpo at paglaban nito. Okay, no matter what we do, sabi nga, the hospitals is not there. But it's ours talagang kasagutan in terms of controlling this one. Discipline, okay, preventing the discipline, and at the same time promoting health promotive activities will be one of the most important factors. So again, for Dr. Audan, maraming salamat for the information and the statistics. I know, okay, the people working right now in SPMC pagod na pagod, but with all our gratitude, maraming salamat sa inyong walang sawang pag-aalaga sa mga pasyente natin, especially in the entire region of Davao City.
Okay, thank you so much, Doc Nestor, for that insightful reaction. Again, also in behalf of the James College of Medicine, salamat talaga sa mga ating frontline health workers, especially there in SPMC. Marami po sa ating faculty from the JMC College of Medicine are working there. So parang lagi talagang ini-include natin sa prayers sila, ang buong staff, so that hindi sila ma-infect ng COVID-19, because one of the very essential sila right now. So especially in our battle against COVID-19. Sabi nga ni Doc Audan kanina, hindi money ang solution dito. Even the developed countries will find it very difficult to end this uh, invincible war against this virus. So more on the discipline, more on public and preventive measures. So ako, before we proceed to the students' reaction, ang ating stream, because especially to your relatives and friends, because napakaganda ng ating discussion tonight. So, sige, sa mga students natin, we have tawagin na lang natin from the our third year level representative, from someone from the third year level, si Kim Zamora, to give her reaction or some questions regarding the COVID-19 situation here in Davao City and SPMC.
So first of all, good evening po, doctors, and to everyone who are watching. Thank you po, Doc Audan, for the insightful discussion on COVID-19 and the current updates about it. This discussion reminds us on how, despite having online classes po and staying in our homes, sobrang dami pa rin cases and the fight against COVID is still ongoing. One question raised po is, with the current rate of the vaccination drives against COVID-19, how possible is it to achieve herd immunity before the 2021 ends po, Doc?
Yes. Actually, no, it's nasa tao talaga. Disiplina, yung enthusiasm to get vaccinated. Because for the Philippines, we need 70% or 75% herd immunity. And I think as of today, parang it's less than 5% pa tayo for this. That's why it takes time. It takes time, really. Kaya ang ang aking ang dream ko dito sa SPMC, sana lahat ng SPMC yan will be get vaccinated. At least kami dito magkaroon ng herd immunity. But with the data that I've shown to you, mga reasons, no? Kaya puspusan naman kami ng reorientation. We need to reorient them for this matter. So, I think nasa tao talaga, nasa Filipinos, no? If really want to have a herd immunity, you invite others to get vaccinated, you promote vaccination, you promote the importance of vaccination. That's the only way.
Okay. So, yun nga, I think with our coordination last time with the City Health Office, it was mentioned that the City Health Office or the City Government of Davao also wants to achieve that before the year ends. Kaya para ang daming partnership na ginagawa even with the private sectors to set up different COVID vaccination sites. As far as that was just a month ago, almost a month ago, na parang nag-set up na ng around 60 vaccination sites here in Davao City and counting pa yan. So, ginalagay so with that partnership with different sectors of the community, even the private and the public, so we are hoping na ma-achieve natin yung target na herd immunity before 2021 ends. So at least in that way, we can return to some semblance of normalcy by 2022. Kasi di ba parang noong 2020, we were hoping na 2021, okay na, parang we will be returning to normal, pero hindi pa rin nangyari. So with this COVID vaccination rollout, we should be united to achieve that target. So now I would like to ask or give the virtual floor again to one of the students, from the second year level, si Icon, Concepcion Cortez.
Good evening po, Doc. Good evening, Doc Audan and Tardin and Dr. Bongkoban and also my classmates and to all that who are watching tonight. Thank you po, Doc Audan, for that insightful lecture. And I just realized the most lectures that I have like encountered about COVID, medyo highfalutin siya and overwhelming. But the one you have delivered is parang personal siya or close to the heart because the statistics is mostly sa Davao. So parang as a Davaoeña, parang nakakampante kami, Doc, na okay, natatrack pala talaga nila. And then it's nice to know that we are in good hands kasi maraming reactors. or maraming mga post, mga false information that always bashing the system, the healthcare system, and because they don't understand. And from the lecture, nakikita naman din talaga. Of course, we cannot just strictly mag-lockdown nun tayo kasi of course, ang economy at saka yung paano din yung mga tao na kailangan pa rin mag-work somehow. And it was nice to also understand bakit yung mga variants ay nakakatakot siya or bakit kailangan pa rin talaga natin mag-wear ng masks, mag-wear ng ating mga PPEs despite having vaccinated. Kasi yun nga, naging, ay na-mention kanina na it turns out na parang sila na naging carrier kung sino yung vaccinated kasi kahit na asymptomatic sila and kampante lang sila, pwede pa rin sila ang magdala ng COVID. So hopefully and we're all praying that nagka-herd immunity na and somehow din everybody, especially the staff of SPMC and other healthcare workers, hindi lang yung health po, Doc, also yung mental well-being kasi grabe talaga ang fatigue, grabe talaga ang feeling of hopelessness and pressure sa as a health sector ngayon. So we are all praying for your well-being, not only physically and also emotionally and mentally po, Doc. Tapos, question lang po namin, Doc, as a student po who is hoping to become one of you guys, mga doctors na we all look up to, what could you say is medyo pageantly siya, pero anong biggest lesson na the pandemic has taught you that you would want to impart sa students ngayon before they become doctors in the future that we could carry sa generation na amin namang i-lead, Doc?
Well, lesson learned siguro nito is really not to give up. There is always hope. Dapat yun ang tandaan natin with this uncertainty, no? Na meron talagang pag-asa. And I think that's the best thing that we should inculcate na because there's actually no drugs yet. Everything is still experimental, no? So and even with these clinical trials, ang COVID talagang increasing pa rin siya. So ang atin lang dapat hindi mawalan ng pag-asa, but sooner or later magkaroon tayong the right medication for this COVID. So the word hope, no? Yun ang lesson ko. Even here in SPMC, minsan depleted na ang aming mga resources like the PPE, other mechanical wear. But I still look for hope that someday there will be donors, no? So, and it came siya. So, yun lang sa akin na hindi mawalan ng pag-asa, always strive and don't give up. Yun talagang nakikita kong lesson learned.
Thank you so much, Doc.
Thank you. I think it's a universal lesson, no, for everyone, no, not to give up hope, no. It all lagi namang merong sunshine at the end of the rain or parang ito. So we were in the darkest times, pero now we're actually recovering, no. Still remember the sobrang uncertainty, sobrang maraming unknowns during the first few months ng COVID-19. No, the doctors are actually blind to many are parang hindi talaga we are not familiar with the disease, with the COVID-19. So marami talagang naging problems and issues during that time, but now we are recovering. The healthcare system is recovering, the economy is recovering. So just konti na lang, we are ma-achieve na natin yung again the norm, makabalik tayo. We're hoping na makabalik tayo to what was actually look at our the healthcare system, kung ano talaga naging source of ang mga problems, challenges there. Now, maganda rin question yun actually kay kay Dean. Dean, as one of the COVID physicians, what was the lesson this pandemic? Parang as taught you, Doc. Parang ano mas-share mo na biggest lesson with the current pandemic po?
I think one of the biggest lesson and responsibility of a doctor is really more of educating the lower socioeconomic area. Kasi nga, sabi nga natin, walang effective treatment. And the only way is to educate them from the misinformation that they're getting from the social networks. And sometimes even healthcare workers. I have some healthcare workers who've been taking ivermectin. And then I was telling them, have you seen me giving ivermectin on my patient? Okay, and then they're taking it like as a prophylactic treatment. And then I say, I am treating patients. I am human patients. I'm not treating animals. So I think correcting this misinformation, like it's so funny sometimes ang publiko, like they don't want to get vaccinated because they don't want to become zombies. Di ba? Okay, it was talagang parang halo sa mga The Walking Dead natin dito. Kaya nga, siguro one of the biggest lesson talaga is really educating them, okay, as an educator. Okay, this is very, very important, okay, at whatever level, especially those people who na wala talagang medical background, they are the one that really in need of proper information. And I think this is the correct forum or the correct way of correcting misinformations. Marami pa. Okay, I've been working in Kidapawan, I've been working in Digos, and sometimes there are a lot of questions from patients and watchers. And sometimes for us doctors and medical workers, these are questions that are really medyo nakakatawa. But like, because they don't have adequate knowledge on this one, it is our greatest responsibility to really educate them. So you have to give time to them to educate them. And I think that's one of the learning that we have learned from this pandemic.
Yes, I agree, Doc. No, so talagang actually doctors are expected. There are a lot of things to be expected kapag doctor ka na eh. Pwede kang teacher. You're expected to be a teacher, researcher, everything. So I think maganda talaga mag-start tayo within the family, within the relatives. Kasi we have experiences sa mismong kapamilya, hindi mo parang when they read something on the internet, on the social media, mas paniwalaan pa nila kaysa sa'yo as a healthcare professional. So I think we need to start with our family members, our relatives, our friends, then our community, our neighbors. So then spread yan, yung information dissemination, health education will spread. So again, next, after that, I would like to call on si Amir from the second year to give his reaction or he can field some questions regarding the discussion regarding the COVID-19 situation. Amir?
Doc, good evening. Is it possible in our current situation na magkaroon ng drive-through vaccine?
Yes, that's very possible. In fact, I think we are doing also pwede yung house to house or ginagawa kasi that's the only way to really to reach them, no? Kasi ang iba hindi talaga, because really that's one options na talagang we will develop herd immunity kung marami tayong mabakunahan. So yan, yung drive-through, pwede yan siya, pwede house to house, any options as long mabakunahan, that matters.
So, Amir, do you have any more questions? So I hope nasagot yun. So parang we really need to utilize every method that we can think of. No? Especially sa ating bansa, it's an archipelago. No? Tapos maraming far-flung areas that we know that there are patients nga na hindi makapunta sa mga vaccination mga people that can't go to the vaccination sites. Why? Financial problem, wala silang pamasahe, no? Ganun. Those are some of the reasons na parang hindi natin parang simpleng reason pero sa kanila mabigat na yun na reason. That was why hindi sila makapag-vaccinate. So maganda talaga na we must look for other methods to ensure na ma-achieve natin yung herd immunity. So, okay. So hopefully may mga questions pa kaya sa ating mga medical students. Sa mga viewers po natin, so those who are watching at their comfort of their homes or their offices, if you have questions po, just put it in the comment section below para po masagot po natin. No? Okay? So, meron pa kaya sa ating mga baka wala na kasi masyadong parang yung information na naibigay ni Doc Audan talagang okay. Talagang napuntirya yung current COVID situation here in Davao City. Lagi kasi nakikita natin yung statistics ng buong mundo, buong Pilipinas, but sometimes hindi natin alam yung sa ating mismong region, which is very important to all of us. So, Doc, may question. Docs, meron pa ditong question. Is it safe na ba to wear cloth mask?
Actually, in view of these rising cases, the DOH actually discouraged using the cloth mask. However, kung wala talagang surgical mask, it's an option to have a cloth mask, pero dapat dalawang cloth mask, hindi lang isa. Kung wala na talagang iba. But in this surge, DOH is actually discouraging wearing the cloth mask. Pero kung wala talagang option, you can have it pero dalawa.
Okay. So, yan. So again, dalawang cloth mask, no? Even nga, Doc, 'di ba, parang kahit nga surgical mask, some of them parang advice din maganda double mask pa rin ang gamitin, no? So
yes.
So yun, meron pa bang we're still looking if may questions pa sa comments. So again, so parang wala. So marami naman questions, marami tayong na-discuss na today. So now I would like to give the floor na sa one of our sa ating last student reactor, si Joshua Agawin from the second year. No? Joshua?
Hello, good evening everyone. Good evening Dr. Arce, Dr. Raymond, and I am glad to hear out from Dr. Audan for a promising presentation earlier. So I worked as a COVID nurse prior to being a physician in Southern Philippines Medical Center under Dr. Audan. So it is with familiarity to me the experiences that Dr. Audan shared, especially those joys of having a freeway, yung mga daanan na wala talagang kotse, as well as the sadness of eating alone in wards or in our nurse stations. So along with this, it is not only we, the healthcare workers or the frontline workers, who are facing fear. So it is the fear of unknown that is being experienced by all. So during those times kasi the IATF and the Health Organization protocols on COVID-19 were very fluid due to the fact that we're facing a novel coronavirus. So moreover, I would like to commend the leadership of Dr. Ricardo Audan during these times. So the institution faced a big job as a surge of, or the first wave we experienced last June to July, if I'm not mistaken. So this has not only affected the physical health of our personnel, as well as more importantly, na-iterate dito sa symposium na ito is the mental health. So it is much appreciated na bigyan ng tuon yung mental health on the psychological aid program that was implemented in SPMC before, and I presume that it is being done right now. So with this, now that I am aspiring to become a physician, I'm asking my fellow students to put the current situation of the healthcare workers as a motivation for us to finish our studies and in the future to serve back to our very humble institution, the SPMC. Thank you very much.
Thank you, Joshua, for that. No, so ayan. I also parang it's very encouraging that we have these future physicians to parang in the later part sila na yung magiging uh, frontliners, I hope that agents of change in the healthcare system of the Philippines. No, we know that uh, really need to go back to the public health. Uh, we need to highlight or emphasize public health approach, especially against these communicable diseases. No, we do not know that kung kailan pa talaga tayo matatapos. But we know that with the efforts of everyone in the healthcare sectors, efforts of our colleagues and the healthcare professionals from the Southern Philippines Medical Center, headed by Doc Audan, tapos, and the City Health Office, the different institutions, we are all actually one united to ensure that this pandemic will end, hopefully before 2021 ends. No? So, yan yung ating collective effort right now, and it needs a multi-sectoral approach, hindi lang ano, hindi lang the healthcare system ang mag-work out nito, magkatrabaho, but everyone from the different sectors, from the private and public institutions. Even dun sa mga nanonood sa atin, mga viewers natin, I know baka sa isip niyo wala kayong magagawa to help in this pandemic, but the fact that you're staying at your home, no, hindi nakikipag-mingle, observing the universal precautionary measures against the pandemic, against the virus, are a big help na to curb this disease. No? So, I hope that we have learned a lot from this discussion, from this session. Nakapag-provide ng clarity to some of the questions, to some of the issues na na highlight yung what are the facts, what are the truths, rather than the misconceptions, sa mga myths, sa mga sabi-sabi na especially here in the social media. No, and of course, we have learned a lot sa current situation here in Davao City, in Davao region. So, I think that would be the end of the questions and some of the reactions of our medical students and the rest of the JMC family. So okay. So but if you have questions, you can also still send it in the comments. Doc, our discussion in behalf of our founding president, Reverend Dr. Pastor Apollo Sikibuloy, and the whole JMC family, the JMC College of Medicine. We would like also to congratulate Dr. Ricardo Audan for being appointed as the new chief of the Southern Philippines Medical Center. Thank you. No? Great. So, yun po, congratulations po, Doc. I think we are here. The JMC family will continues to support the SPMC and your leadership in the hospital. So salamat po sa SPMC, salamat sa mga sacrifices ng healthcare workers, especially against the pandemic. So I think I would like to give back the virtual floor, to our host, si Sir Vincent Mendoza.
Yeah, there you have it. Once again, congratulations po, Dr. Rick Audan, for assuming the office as the new medical chief of SPMC. That's from Pastor Paul Kibuloy and the whole JMC family. Surely we have learned a lot from this time of discussion, and now to formally express our institutional gratitude, may I present to you the certificate of appreciation. Technical Director, can you please present that on screen? There you go. Let me read it first. Jose Maria College, Philippine-Japan Friendship Highway, Davao City. Certificate of Appreciation is awarded to Dr. Ricardo B. Audan, the SPMC Medical Center Chief, for his selfless service in sharing his knowledge and expertise as our highly esteemed resource speaker in the webinar Journal of Healthcare Services, the SPMC Experience, during the JMC EduTrends live stream program given this 19th day of August 2021 at the San Maria College, Philippine-Japan Friendship Highway sa Davao City, Philippines, signed by our school president, Dr. Felix C. Chavez Jr. Ladies and gentlemen, a round of virtual applause, please, to our resource speaker. Once again, thank you so much, Doc. We are more than grateful to our medical frontliners, and we are equally thankful then to our nurses, doctors, whoever nakasali sa ating frontliners for being there in spite of the toil of taking care of a number of patients being housed at Southern Philippines Medical Center. This has been JMC EduTrends, produced by the Jose Maria College Communications Office. Don't forget to find and follow us on Facebook and YouTube for more updates. This is your host, Lord Vincent Van Mendoza. We hope we've had the pleasure of your time. We hope to see you in our next episode. Keep safe and goodbye, everybody. Once again, thank you so much, Doc. Congratulations.